Good morning. My name is Dr. Jill Ratner. Let me tell you a little bit about my organization that I'm here representing and about myself. The organization is Hands Up for Haiti. It is an organization that is a nonprofit operating in northern Haiti with its sole mission of improving health care for the entire population. We do this by hosting approximately one trip a month during the course of a year. We have 25 staff in Haiti currently, and we run 2 clinics and 4 malnutrition programs. We have accomplished so much in our short 6-year time span, basically because we collaborate with others on the ground, work with the Ministry of Health and existing healthcare facilities. We work with the professionals side by side to provide better care, but also to give educational opportunities to our medical colleagues in Haiti as well as to the community. Myself, I am a pediatrician. I've had the privilege of doing primary care pediatrics for the last 30 years. I am chief of pediatrics at the Mount Kisco Medical Group, where I oversee 51 pediatricians. I have served as chief at the local hospital. I have an appointment at Mount Sinai as an associate professor and also an affiliation with Mass General Hospital. The pitch today is about infant mortality and maternal mortality around childbirth. The statistics in Haiti are devastating. 56 per 1,000 babies will die in the first year of life, and 35 women die around issues of childbirth per 1,000 every year. We think that is the problem worth addressing, and our solution is a local solution to look at local training of a community leader selected within a specific community to lead a women's support group around issues on a weekly basis having to do with prenatal, delivery, and postnatal care for both mom and baby. We would train these individuals in a rigorous program that would extend over a 6-week period of time, which would be infused by the expertise of our volunteers as they come down, as well as by our Haitian professionals who are on staff full-time. We believe this will give adequate oversight to our program and allow us to really fine-tune it as we go along. This is not a completely novel idea. The idea of having support groups for women has been used in Nepal and has been shown to be effective in reducing infant mortality and reducing postpartum depression. Our piece would be to bring it to Haiti and also include the piece of improving access to care. We would take as our assignment to make sure that women receive 4 prenatal visits a year, and we would arrange for transportation, as well as arranging for transportation to babies after birth within 48 hours. We have clear indicators and measuring devices that we can use. We would propose that 90% of our women receive prenatal care, that 75% of our women have a trained birth attendant who knows neonatal resuscitation at the time of delivery. We teach helping babies breathe, and we can certainly accomplish that. And that 60% will breastfeed for the first 6 months and take their babies for an exam in the first 48 hours of life. These are measurable statistics. Our organization is funded by a robust donor pool, by our medical missions that are ongoing, by our volunteers, and by our grants. Part of our ask today is to ask you for your expertise in terms of novel funding options, grant opportunities, and partners that we could work with both nationally and internationally. The beauty of this program is that it's been tested before, but we're expanding upon the capacity of the program. It is also very easily scalable to other areas of Haiti, where we have worked with professionals in the South and other organizations that work in the West. It is also scalable to a lot of countries in the world, such as Uganda, where we have worked with other professionals. I think you can see the beauty of local teaching. Teaching a mentor to lead a women's group, teaching women to get together and support each other. We believe that our ongoing presence and our knowledge of these communities and these local villages will allow us to have the oversight that's necessary. We also feel that we'll be able to fine-tune the program, see what goes wrong, what goes right, and really have an opportunity to adjust it. Thank you so much for your time. I'm looking forward to the conference, to meeting everybody and presenting more of the idea.